Let me initially thank the witnesses for arranging their schedules so that they could testify before the subcommittee this morning. I know how busy you all are. And obviously, as the chairwoman DeGette said, we're here today to continue our critical effort or oversight of the COVID-19 vaccination campaign in the United States. And that has great promise, really, at this point, to help us beat the pandemic. We've all been working hard in Congress to help expand the availability and administration of the 3 available vaccines around the country. Last week, President Biden signed the American Rescue Plan into law, and this obviously invests in the tools and resources needed to crush the virus and provide relief to struggling families. Specifically, the bill provides more than $20 billion to speed up COVID-19 vaccination efforts across the country, supports the development of community vaccination centers, and provides funding for mobile vaccination units in underserved areas. Now, many of you know that I was critical of the Trump administration for leaving it up to states to compete with each other for testing, medical supplies, et cetera, over the last year. There was no national effort really on the part of the Trump administration. It was pretty much left up to the states. And while the initial vaccine rollout under the Trump administration was bogged down because of, in my opinion, poor planning and limited state resources and supply, the Biden administration has taken decisive action to get the COVID-19 vaccination effort back on track. Since President Biden took office, the weekly vaccine supply sent to states has more than doubled, and states have been given more advance notice of their vaccine allocation. We're now on track to have enough vaccine supply for all American adults by the end of May, 2 months earlier than prior projections. And the Biden administration also continues to prioritize efforts to ensure equitable distribution or access of vaccines for marginalized communities and Americans who are more vulnerable to severe disease. President Biden's also focused on the well-being of children and families, recognizing the need for students to return to in-person school as soon and safely as possible. President Biden has encouraged states to expand their vaccination eligibility to teachers and school staff. And he also expanded the retail pharmacy program to help vaccinate educators by providing additional doses and helping educators schedule appointments. The American Rescue Plan also provides nearly $130 billion to help schools reopen safely and support students and staff returning to the classroom. And thanks to the Biden administration's efforts, we've already seen encouraging results. More than 70 million Americans have received at least 1 dose of COVID-19 vaccine. And last week, President Biden set the aggressive goal directing states to make all American adults eligible for the vaccinations by May 1st. And I applaud the president's ambitious proposal and look forward to working with the administration to achieve this bold benchmark, obviously with all of our witnesses. Now, despite these tremendous efforts and the progress that has been made by all 3 of our witnesses, we can't be complacent. As the president told the American people last week, and I know Dr. Fauci keeps saying it too, I hear him all the time on the media, that the government alone cannot defeat this pandemic. It's going to take all of us doing our part to beat this virus and return to our former lives. And the stakes couldn't be higher. The longer it takes to vaccinate America, the more we risk further spread of the disease and increase the likelihood that new variants will continue to spread. So I'm pleased that we're joined today by a distinguished panel of scientists and public health leaders from the Biden administration. I look forward to hearing how we can continue to make progress and respond to the challenges that remain in the battle against the pandemic. I know that all of you are constantly out there. One of the things that I know that you continue to stress is that people should not be afraid to take the vaccine. And I don't want to stress that too much in my opening remarks now. But I still do worry when I go around. There are many people who either will tell me that they're afraid to take the vaccine or won't tell me that directly, but I know that that's what's going on in their minds. And so I know that that's an important part of the American Rescue Plan, too, is I think there's $1 billion that was part of our that Energy and Commerce initiative on the bill to basically have a program and make people aware that this is something that they should participate in. So thank you again, Madam Chair. This is a very important hearing. I appreciate it.